presentation on research direction and trend in traditional medicine of Thailand. The role of AI it will be delivered by Dr. Surakamet Mahasiri Mongkol. Dr. Surakamet is the Director of Technical and Planning Division and the Director of Research Institute in Thai Traditional and Alternative Medicine of Department of Thai Traditional and Alternative Medicine. He holds a Doctor of Medicine and a Master of Science in Genetic, Epidemiology and Bioinformatics and PhD in International Health. He has held key roles in the Ministry of Public Health, including Medical Officer and Director at Bangalore Hospital and Chief of the Medical Genetics Center. In 2023, he was appointed Director of the Information and Communication Technology Center. Dr. Surakamet is also a recipient of multiple National Innovation Awards and has a substantial publication record in international journals with a current research interest in genetic risk to tuberculosis and pharmacogenomics of antibiotics. Please welcome Dr. Surakamet Mahasiri Mongkol.
Good afternoon. Okay. So, it is an honor for me to be invited to speak in this occasion. So I am the Director of the Technical and Planning Division of the Department of Traditional and Alternative Medicine. So I will be speaking about research selection and the role of artificial intelligence in TCM in Thailand. Okay. I will use about 30 minutes to explain what I'm talking about. Okay. It disappear. Anyway. Let me orientate it a bit. This year, Thailand is proposing the 3 billion baht budget investment in expanding the herbal medicine products within the National Health Security Office. So Thailand has the Universal Health Coverage Program, and the Universal Health Coverage Program in Thailand cover everything, including traditional and complementary medicine. Previously, the traditional medicine was supported for around 5 million baht a year. But last year, that budget expanded 3 times to 1.5 billion baht. And next year, it will be double to 3 billion baht. And that is the vision of the Minister of Public Health, H.E. Somsak Thepsutin. He is supporting the herbal medicine to be expanded. Within the municipal public health, overall budget for drug usage is 30 billion baht, and only 1 billion baht is used for the herbal medicine. And he would like to expand it to 3%, 2 to 3%. That's why he expand the budget to be paid from the Universal Health Coverage. And that budget not only include the herbal medicine, but we also include the Nuot Thai, or the treatment of musculoskeletal problem with Thai massage. And we also support for the personalized formula using herbal medicine, which is not included in the essential drug list. And we are aiming for treatment of psoriasis, which is commonly used in Thailand. We already have at least 10 hospitals providing psoriasis care for those patients. We use Thai traditional medicine at that 10 hospitals. But the reimbursement program is not supporting that treatment program yet. But this year, I mean, next year, we will be supporting the psoriasis treatment program for personalized traditional herbal medicine formulas. And that is the one of the strategy. Additional strategy is on the expanding the herbal market. And this market is not only for the drugs, but we use we use herb for drugs, food, and also herbal products, which includes cosmetic. So that is another strategy of the government, and that strategy is expanding from around 50 billion baht into 100 billion baht in the next 3 years. So that is the national plan. And we developed the research plan according to that two strategy. That two strategy is the new strategy for supporting herbal medicine. So we have established the research plan for that. And in the first year, the main objective is increase the confidence in the use of herbal medicine. We already have clinical trials and research evidence to support those 100 something drugs into the essential drug list, but the confidence is still low for the general healthcare professional. And what we are going to do is we are going to do phase 4 trial for those medicines to expand the confidence. And we are going to do the research on the adverse events of those herbal medicine. Thai is using, the Ministry of Public Health is using the herbal medicines in the routine practice. Last year, we prescribed 15 million prescriptions that include the herbal medicine from around 200 million prescriptions in the Ministry of Public Health. So that 15 million prescription will be analyzed for the efficacy and the adverse drug events. And that has never been done before, but we will build the system to analyze those data. And then that framework came from the research evidence across the country. In February this year, we have a research meeting in the hotel around here in the Ministry of Public Health, and we invited participants from Faculty of Pharmacy, Faculty of Thai Traditional Medicine, Faculty of Medicine, and from that meeting and several surveys, we gathered 310 research questions, and that research question will be put into the national research plan for herbal medicine. And in the next 3 years, we will try to answer those 310 research questions and provide the budget to do it. The key research projects are the Trust Research Environment Platform, and that is a system to gathering the data from the 15 million prescription into the accessible database, because that 15 million data came from the service data. We have name, surname, identification number, and to allow the researcher to access those data, we have to do a proper anonymization, and we have to secure the way to access the data. So we are going to employ the Trust Research Environment or Secure Data Environment Platform. This is the similar platform that used in UK when they provide the COVID-19 data for researchers in UK. They call it Open Safely, and that similar platform will be applied to the herbal medicine prescription data in Thailand, and that is going to cost us $3 million. And we are doing research with the orthopedic surgeons, because the North Thai and several herbal medicine is used for musculoskeletal problems, and many of the drugs that we use, the orthopedic surgeon does not heard about it. Many of the doctors, they don't know that drug is using for their patients in the hospitals. So we need to provide information to them. And the phase 4 trial is aimed for that kind of confidence building to this group of doctors. And in this year, at the annual orthopedic research meeting in October, the orthopedic surgeon is providing one section for herbal medicine and Nuot Thai to be presented in their Royal Society meeting. And that is the way to communicate to the orthopedic surgeon in Thailand. And we are going to do the psoriasis research. We believe that the immunomodulator for psoriasis can be replaced by Thai traditional medicine because we have seen the data from the last 10 years treatment at the pilot 10 hospitals. And we are going to expand that to the primary care setting, which is including 900 hospitals across Thailand. But this is going to be phased implementation. It will be 3 years plan from the 10 hospitals and expand to the hospitals that interested and then expand to the whole country. And the last one is the positive claim because some of the herbal medicine is actually going to be used in health promotion. And those positive claims will be put into the clinical trial study and then provide indication in the herbal product regulation system in Thailand. So those are the aims, and then the target herbs that we had already provide consensus by the National Herbal Medicine Committee is the list is over there. And in the next 2 to 3 years, we will provide funding for those. For some of the herbal medicine, like turmeric for pre-diabetes, that is the new indication that had already been studied for the last 10 years, but it had never been promoted or implemented. Those pre-diabetes will be implemented more in the next few years. For the research infrastructure, currently we are establishing the laboratory and research center within the Department of Traditional and Alternative Medicines, and we have the Clinical Research Accelerating Center, which is established because of the previous study does not meet with the ICS GCP criteria when we evaluate the clinical trial. So we are improving the clinical trial in Thailand to be compliant with the ICS GCP criteria. And the CRAC is the new infrastructure to improve the clinical trial implementation for herbal medicine in Thailand. And that is the events in the beginning of this year. In February, we had a big meeting and provide the way for the researcher to participate in the research plan development, national research plan development. And the funding agency agree with us to discuss the 310 research question. In the morning, the funding agency, the Thai Science Research Institute, the acronym is TSRI. The full name is so long, but they are the one who organize all the funding for science research in Thailand. They are agree to provide more aligned funding. In the last 10 years, the research funding is already more than 4 billion baht for herbal medicine. And that is, result in what you see in the herbal expo. But the previous effort is not aligned into a single national strategy. Right now, we are aligning everything into 5 herbal champion products and 8 positive claims. So those 13 herbal medicine will be prioritized in the next 3 years. And we are also aiming for the medical and wellness. In the next year, Thailand will host the Global Wellness Summit, and that will be driving the research direction for us as well. So this is the research direction in Thailand right now. We have the system that integrated with the universal health coverage, looking at the primary care replacement of the Western medicine with traditional medicine. We have the system to promote the herbal products in all areas. And the last one is about including everything into the wellness program. And that drives the research plan that we are doing. We also looking at how we will be using artificial intelligence in our research direction. And World Health Organization has already provided guidance on how to use artificial intelligence in health. And World Health Organization also established a committee for AI in traditional medicine. And Thailand is one of the committee in the AI for traditional medicine committee. We have a monthly meeting, so we are meeting every first Tuesday to generate the necessary document. The first thing that we're doing is the training course for traditional medicine professional, how to use artificial intelligence in traditional medicine. And we are thinking, because Thailand is one of the committee, we are thinking that we will be presenting the result of the AI in traditional medicine by the end of this year in the World Health Organization meeting for AI. This is the draft of the course that we are doing. We are providing the course for ethics and governance for artificial intelligence for health from the traditional medicine perspective. And we have 4 modules. The module 1 is about the introduction. The second module is about ethics and governance. The third module is the applying the ethics and governance on case study. And Thailand will provide case studies for using AI into the modules. And the last one is the multi-stakeholder engagement and operational of the AI system. We are also looking at the role of AI in drug discovery, because currently we have, the Google DeepMind developed AlphaFold, which is the system of AI to predict which chemical will be binding to the proteins. And last month, they provided, Google DeepMind also provided Alpha Genome, which predict the variation in human genome, how the variation will be interact or function with the protein. So we are looking at this carefully, because in the next few years, we will be able to use AlphaFold, Alpha Genome, or Alpha something. Maybe we have Alpha traditional medicine to use it to predict which combination of chemical in our traditional medicine is working on some protein, and we can drill down or develop the new formulas for our patient. And for the Department of Traditional and Alternative Medicine, we have the AI implementation already. So we developed the guidance on how to use AI in the department. It was signed by the Director General this year. The guidance suggests which activities that we can use AI. Like when we develop the document for proposal, research proposal, review article, budget estimation, research proposal draft, or writing the manuscript. Those are kind of things that DTAM allow the researcher and the staff to use AI to help with generating the document. And that is improve the productivity of DTAM in working on traditional medicine. We also have the chatbot, we call it แผนไทย AI, which is a chatbot for Thai traditional medicine. That chatbot is providing for health professional because most of the Thai traditional medicine is not understandable by general doctor in Thailand. We use something like Vata, Pitta, and many of the acronym in Thai traditional medicine. And those have to be explained to the general doctor, nurse, pharmacy, and those who are not familiar with that terms. So we useแผนไทย AI to help those healthcare professionals who are not familiar with the Thai traditional medicine acronym to understand what we are talking about. We also providing that chatbot to the patients. So if the patient have symptoms and they want to use Thai traditional medicine, they can ask the chatbot. If the patient has stomachache or muscle pain, what kind of Thai traditional medicine should be used for him or her? And that is what the chatbot is doing. We had already developed this in the last 3 years, even before ChatGPT is well known, and right now it's already in production phase. So we can providing this as the application or application API. I forgot what it's for, but we can provide it to connect with other program system and answer the question to the another platform. So currently we are already write up the first AI plan for department, and the first plan is about 3 years. The next year we will acquire the Gemini Advanced chatbot. Gemini Advanced user for all of the staff in the DTAM, because we learned that we can use deep research to do review article very quickly, and that will help a lot of us in improve productivity for the department. This is the detailed information to provide with you what is the chatbot, how it was developed. Most of the current chatbot like LLM, like ChatGPT or Gemini S1, if you ask them about the Thai traditional medicine knowledge, it will be blank, because they are studying only English document mainly. So if we publish what we found in English, then that will be easily explainable by Gemini Advanced or ChatGPT. But if the document that we had is in Thai, or the old Thai language, or the local dialects in the past 100 years, then those are kind of things that LLM is not able to access at the moment. We had included that information into that smart TTM library. So we collect everything that we done in the last 10 years into the library, knowledge library database, and we put it into the system, and that is the prior knowledge to train the LLM that we use. And because we developed our chatbot in the last 2 years, so we did not have access to like DeepSeek or Gemma or whatsoever that you can access this year. So in the last 2 years, we have access to Typhoon AI, which is the AI chatbot for Thai language. And the original chatbot that we made is based on that Typhoon AI with that TTM library knowledge. And that is unique to our chatbot. And given that library, we can reassembling the chatbot again. Based on that library, we can now implement it in Gemini Advanced or implement it in the ChatGPT. You can do some chat TTM Thailand. So those are kind of things that we can implement with that smart TTM library. So if you are looking to do this, you do that first. You do the library of your local knowledge. because those are the information that limited accessible to the US based or the Chinese based chatbot, and that is something you need to do first to fully utilize your traditional knowledge for the improvement of the chatbot. And that is what had been done. Okay. This is the chatbot in the mobile platform, and that you can see like a small Thai teenage. I think he look very young, and he's in Thai traditional uniform. So he will answer everything if you ask him about the Thai traditional medicine. And that is the how we did it, okay, to make sure that it's already done, not just in the concept note. And that is what has been done. We select 5 diseases for develop the algorithm. So for those 5 diseases, we collect the real data, and then we use a chatbot to compare the real data with the chatbot result. And we come up with the accuracy of around 90% using the chatbot to recommend information compared to the traditional data collected by healthcare professionals. The study was done in that 10 hospitals to collect the data, and that is already finished. This is the one of the example of the symptom. Most of the symptom I myself never know about it. It's the menstrual symptom in women that described in Thai traditional medicine. And if I have to do this, I have to use chatbot as well. Okay, and that is it. Just go through, and you can try the chatbot yourself. Not sure it's working at the moment, but I hope that it works. Okay.
Come on, Ling.
And that is the. I have only 2 minutes, maybe. Maybe that is all for. For the information I would like to provide, and I can receive your question. Thank you very much.
Thank you, Dr. Surakamen, for the informative presentation. Any question from the floor? Okay, if not, thank you again for your presentations. Physical background. And next we have the presentation on NCD and the use ลงได้แล้วค่ะพอ the use of medicinal plants in Cambodia. We delighted to welcome Dr. Tiang Huat, Deputy Director of National Center for Traditional Medicine, Ministry of Health, Cambodia. Dr. Tiang Huat is an accomplished physician with a strong background in public health and traditional medicine. He previously served as a physician and chief of the referral hospital before becoming chief of the Technical Bureau at the National Center of Traditional Medicine. He has contributed to papers such as bidirectional screening of diabetes and tuberculosis in Cambodia and play a key role in developing traditional medicine policy. Please join me in welcoming Dr. Tiang Huat.
Good afternoon, distinguished guests, ladies and gentlemen. Firstly, I would like to thank organizer, especially Department of Traditional Medicine and Alternative Medicine, Ministry of Public Health, Thailand. Today, I would like to present to give my presentation on non-communicable disease and the use of medicinal plant in Cambodia. I would like to sit down. Yes. Our content, objective demography of Cambodia, highlight our global non-communicable disease, highlight of non-communicable disease in Cambodia, proportional cause of mortality in Cambodia, and top medicinal plant used for non-communicable disease. Objective: to draw attention to audience on the global burden of non-communicable disease, to share the highlight of the situation and data of non-communicable disease and its affection in Cambodia, to share the knowledge of the use of medicinal plant for managing of non-communicable disease. Demography of Cambodia. Total population is 17.03 million as of January 2024. Female is 50.5%. Male is 49.5%. Age over 25 is 54.6%. Sex ratio is 959 males and per 1,000 females. Urban population is 25.8%. Rural population is 74.2%. Highlight of global diabetes. Prevalent in 2021 approximately 537 million adults aged 20 to 79 years has diabetes, represent 10.5% of the adult population. By 2045, this number is projected to increase to 783 million, or 46% increase, while the world population is estimated to grow by 20% over the same period. The prevalence of diabetes is higher in urban areas, 10.8%, than rural areas, 2.2%, and in high-income countries, 10.4%, than low-income countries, 4%. Type 2 diabetes, which account for around 90% of all diabetes cases, the most common types. Highlight global of cardiovascular disease. More than 500 million people around the world continue to be affected by cardiovascular disease. The most common cardiovascular conditions are coronary heart disease, peripheral arterial disease, stroke, and atrial fibrillation. Cardiovascular disease remains the leading cause of the death of globally, responsible for an estimated 20.5 million deaths in 2021. Global cancer. In 2022, there were an estimated 20 million new cancer cases and 9.7 million deaths. The estimated number of people who will live alive within 5 years following a cancer diagnosis was 53.5 million. About 1 in 5 people develop cancer in their lifetime, approximately 1 in 9 men and 1 in 12 women died from this disease. 3 major cancer types in 2022, lung cancer, and breast cancer, colorectal cancer, other cancer such as prostate cancer, stomach cancer, etc. Incidence in Cambodia, diabetes. In 2021, Cambodia has had the diabetes prevalence of 7.3% in the population age 20 to 79, which 596,000 adults living with the condition. The significant portion, 56.1%, remaining undiagnosed. According to STOP survey in 2023, the prevalence of raised blood glucose currently on medication for diabetes for adult age 18 to 69 was 6.3%, more than 1 in 10 adults age 45 to 59, and 1 in 5 adults age 60 to 69 has raised blood glucose or were on medication for diabetes. New case of diabetes in Cambodia in 2024 was 30,279. Cambodia cardiovascular disease. Prevalence of hypertension. Nearly 1 in 5 adults age 18 to 69 had raised blood pressure, defined as systolic blood pressure equal or over 140 and diastolic blood pressure equal or over 90 millimeter mercury, or were on medication for raised blood pressure. Among older men, 33.8% of those aged 45 to 59 and 46% of those aged 60 to 69 had raised blood pressure. Percentage age 4 to 69 years with 10 years cardiovascular disease equal or over 20% of with existing cardiovascular disease. Cambodia cancer. Cervical cancer prevention. 1 in 5 women, 20.3%, age 30 to 49, had been tested for cervical cancer. In Cambodia, around 20,000 new cancer cases are reported annually, with approximately 14,000 deaths from the disease each year. Liver cancer, liver, lung, and breast cancer are the top 3 most frequent cancer in Cambodia. Liver cancer is the most deadly, followed by lung and breast cancer. Proportional cause of mortality in Cambodia in 2019. 24% cardiovascular disease, 14% cancer, 4% chronic respiratory disease, 2% diabetes, 20% other non-communicable disease, 26% communicable disease and maternal and child health and nutrition condition, 10% injury. So non-communicable disease are estimated to account for 64% of all deaths. Highlight of the traditional medicine and complementary medicine situation of the Cambodia. In Cambodia, most of the traditional medicine practitioners are healers. We do not have academic education program on traditional medicine. We have not integrated traditional medicine in public healthcare services. traditional medicine services are available at the private sector only, and we have never had conduct any formal study or research on effectiveness of traditional medicine for non-communicable disease. But many medicinal plants have been used long time ago by healers for treating of communicable disease. Below is the medicinal plant have been used by traditional healers to treat non-communicable disease. For diabetes, we have Proport group is Songshom, Tromarium, and Cantil R, Bemeriat interrupta. This is for diabetes, and medicinal plant for diabetes too. Smile Pokmotchma is Octosiphon aristatus. Trobiprey is larger Stremia floribunda. Chechvia, Muiza albizana, and Smile Pramatmanus, Andrography paniculata. And for the high blood pressure medicinal plant, Trolengtheng is Avara bilimbi, and Bompong South, Nippongtes composiana, was Samai Prey, Passifolia, Fertida, Polium, Polisia, Fruticosa, and Ampel Day Kalung, Oxalis, Corticulata, and Anquibos, Millingtonia hortensis. And for tumor or cancer, they use control domray is Closjana excavata, Langbai, Lia Rubia, and Mokchiniang saw is Pulzoja Zelonica, Chikasrain, Canongal latifolia. Snai is Tribulus aspea, and Tundai Biospermum montanum. Yes, thank you very much for your pay attention.
Thank you, Dr. Tieng Huat, for sharing information from Cambodia. Any question from the floor? Okay, I see none. So I will continue another session. So continue our regional perspective. We will hear about experience and view traditional health service for prevention and treatment for non-communicable disease in Indonesia. We welcome Ms. Rivka Ivana Sebayang, member of Traditional Health Governance Work Team, Directorate of Primary Health Governance, Ministry of Health, Indonesia. Ms. Sebayang brings a wealth of experience to her role. With a Master of Public Health from the University of Indonesia, she began her career at the Cianjur District Health Office, holding various leadership positions before joining the Ministry of Health. There, she served in the Directorate of Maternal Health and Family Health. From 2022 to 2024, she led the working team of Traditional Health Governance, Currently, she continued this leadership role with the Directorate of Primary Health Services. Governance 1. She also a frequent speaker and facilitator at the training session and workshop. Please welcome Ms. Rika Ivana Sebayang.
Thank you. Please. Yes. Thank you, Chair, Excellencies, and ladies and gentlemen. I'm Ripka from Ministry of Health of the Republic of Indonesia. I'm happy to be here with you, and I would like presentation the topic about experience and views traditional health services for prevention and treatment of non-communicable disease in Indonesia. The outline is 1. Background, 2. Traditional health services in healthcare services, 3. Traditional health services for prevention and treatment of non-communicable disease. For summary, 1. Background, disease. Ladies and gentlemen, it's a great pleasure to share with you today our country's effort to reform community-based primary health care as a core pillar of the government's health and transformation agenda. The Ministry of Health is working to transform the health system through the 6 pillars of transformation so that in the future the Indonesian health system will become stronger, better, and reach out to serve the whole community. In line with the Ministry of Health's commitment to transforming the health system, traditional health services supports one of the pillars being carried out, namely transformation of the primary healthcare transformation. Indonesia's service coverage still lacks many of its ASEAN peers, and a significant gap remains towards high-income countries. As we embark on this transformation in 2021, the need for primary healthcare improvement was unquestionable. The minimum service standards of the health sector in that year have not reached the specified targets like many of our peers. Our country's burden of disease was shifting from communicable disease to non-communicable disease, but our service delivery had not responded. Most of the cases of premature morbidity and mortality were preventable, and the largest healthcare costs were used for referral health services for the same disease. This shows us that primary health service must be a strength in responding to the population burden of disease. Traditional health programs in Indonesia are adjust to the life cycle in their utilization. This is adjust to international health programs and goals in supporting the 2030 SDGs target with promotive and preventive, such as Goal 3, ensure healthy lives and promote well-being for all at all ages. Traditional medicine has been shown to be effective in areas such as maternal and child health, non-communicable disease, communicable disease, palliative care, and the care of the elderly. Indonesia hope in integrating traditional medicine into healthcare services can more efficiency and cost saving. It can lead to better health outcomes and economic advantages. Integration of traditional medicine in healthcare services such as baby massage, herb remedies and acupressure for maternal health, herb remedies and acupressure for communicable disease and non-communicable disease, and acupuncture. Next, in Indonesia, traditional health services policies are contained in Act 17 of 2024 concerning health system, Government Regulation Number 28 of 2023 concerning traditional health system, and Presidential Regulation Number 72 of 2012 concerning national health system, and Presidential Instruction Number 6 of 2016 concerning accelerating the development of the pharmaceutical and medical device industry. Ladies and gentlemen, the 2018 Basic Health Research in Indonesia, we call Riskesdas, results show an increase in people utilizing traditional health services from 30.4% to 44.3%. Types of traditional health efforts that are most widely used are manual skill by 63.5%, ready-made ingredient by 48%, and homemade herbs by 31.8%. And Indonesia, 1 in 3 people has used a product or traditional medicine, and there are 2,848 species that have been identified as medicinal plants. Research on medicinal plants and herbs 2017. This shows the great need and interest of the Indonesian people in traditional medicine, so that it has the potential to be developed in the future. This is reinforced by the direction of the President of the Republic of Indonesia to the Minister of Health to prioritize promotive and preventive aspect by making innovative efforts so as to educate the public to live healthily. In addition to the use of traditional health in other health programs, it has also been implemented in non-communicable disease control program, supporting the reduction to type 2 DMKs, hypertension and cholesterol, as well as in effort to reduce maternal mortality rate and infant mortality rate and improve community nutrition. If we look from utilization of traditional health services by type, Indonesia have many variation utilization in every province for herb and traditional methods. Jambi is the province with the highest utilization of ready-made herbal remedies, and Central Papua is the province with the highest utilization of self-made herbal remedies. And South Kalimantan province has the highest utilization of traditional methods. Traditional medicine product classification in Indonesia divided into jamu, standardized herbal medicine, phytopharmaca, and the new is other natural ingredients medicines. Jamu is supporting evidence by empirical data, traditional knowledge, or local wisdom. Standardized herbal medicine have preclinical data for safety and efficacy and produce using standardized raw material and product. Meanwhile, phytopharmaca, the safety and efficacy are scientifically proven through clinical trials and produce using standardized new material and product. Until now, there are more than 15,000 products of jamu, 77 products of standardized herbal medicine, and 20 products of phytopharmaca. Especially for phytopharmaca, has issued phytopharmaca formulary for 5 class therapy based on phytopharmaca product category. There are for cardiovascular system, metabolic system, gastrointestinal system, immune system, and nutrition. The phytopharmaca formulary is expected to be able to increase the utilization of phytopharmaca, which will ultimately increase research activities and phytopharmaca production in Indonesia. 2. Traditional health services in healthcare services. Until 2022, there are 1,600 traditional health worker graduate of traditional health diploma and 5,032 health worker, it as medical doctor, nurse, and midwife, has traditional medicine competency, it as acupuncture, acupressure, health methods, and Ayurveda. There are 46 government hospitals with trained herbal medic practitioners, 195 government hospitals with trained acupuncture practitioners, 2,814 community health centers with trained acupressure practitioners, and 83 community health centers with trained acupuncture practitioners, and 15 Griya Sehat. Griya Sehat is traditional health facility. This is example of providing traditional health service at a community health center in Indonesia, like Susunan Baru, Lampung. This is primary health care and community. Acupressure, herb, and acupuncture. This is healing garden in community health center. The following are several examples of land used for planting family medicinal plants. We call toga, which can function as green open space, and healing garden. The healing garden is beneficial for patients, patient families, and staff at the location. This is Bogor, Aceh, North Sumatra, Bandung, Minahasa. This is healing garden. Now, Indonesia have 15 Griya Sehat provide traditional medicine as complementary by using acupuncture, acupressure, Indonesia massage, and herbs. This is beside that, government has encouraged to utilize of herbs garden as healing garden, media education, and wellness tourism. This is healing garden, Dr. Sarjito Hospital in Yogyakarta. Various efforts have been made for promoting traditional medicine to communities, such as traditional medicine practice in primary healthcare or hospital, or utilization of jamu as welcome drink in hospital, cafe jamu especially for younger population, traditional medicines research-based use by healthcare professionals, increasing the competence of health workers through education and training, the availability of traditional health facilities called Griya Sehat, new technology development of information system, and developing wellness tourism by using jamu and spa. This is wellness tourism has a growing good prospect in the future. Therefore, Indonesia through the Ministry of Health and the Ministry of Tourism is trying to manage and develop wellness tourism. The development of wellness tourism using herbal drinks, aromatherapy, healthy foods, and spa can be a combination of medicine, economic value, tourism, and education as an effort to introduce jamu as Indonesian herbal ingredients. This effort is held with a collaboration of pentahelix, academic, business, community, government, and media. Next, traditional health services for prevention and treatment of non-communicable disease. Traditional health services carried out in the prevention and treatment of non-communicable disease are conducted at the community level and health service facilities level, such as primary health care, we call puskesmas, and hospital. Prevention of non-communicable disease at the community level is done through the self-care family medicinal garden program, we call Asmantoga, which means families are encouraged to grow medicinal plants in their yard or share area in group, with the result being made into jamu concoctions useful for increased immunity. Meanwhile, the treatment of non-communicable disease at primary healthcare and hospital are utilization of jamu. The Ministry of Health provide guidelines, technical instructions, and a pocket book for the use of herbs to support maternal and child health, stunting prevention, CD and NCD control. This is resep jamu to increase immunity. Recipe 1 ingredient you can read. Recipe. And next, health service facilities level. Treatment of non-communicable disease at the hospital. Here is experience at Hortus Medicus Clinic at Dr. Sarjito Hospital in Yogyakarta shows improvement in patient suffering from non-communicable disease such as hypertension, diabetes, fatty liver, chronic hepatitis, dyspepsia, osteoarthritis, and cancer with the consumption of just jamu, have remedies, only with jamu, only drink with jamu, only drink jamu. Example, hypertension, control 25%, improvement 45%, 30% complementary with chemical drugs. Fatty liver and chronic hepatitis, control with improvement to normal SGPT 75%, 25% complementary with antivirus. Dyspepsia, control 70%, 20% complementary, 10% with no improvement. Hypercholesterolemia, mild grade 50% reaching normal, moderate 30%, severe complementary with chemical drugs. Hyperuricemia, 60% decrease to normal levels, mild, moderate, the rest complementary with chemical drugs. Quality of life for cancer patients during after chemotherapy, reducing side effects of chemo such as nausea by 80%. Cancer without chemotherapy, whether with surgery or not, 10% show improvement. Osteoarthritis, 60% improvement. Hemorrhoids grade 1 to 2 has 70 improvement, grade 3 to 4 has 50% improvement, the rest area complementary. Next, the medicinal plants that have been researched and formed into herbal remedies that had been scientifically proven currently amount to 12 types, namely scientific jamu, herbal remedies, or mild hypertension, gout, gastric disorder, stomach, arthritis, hemorrhoids, high cholesterol, liver function disorder, weight loss, blood sugar lowering, urinary tract stones, physical fitness, and breast milk booster. Example, herbal medicine for high blood pressure, celery herb, pegagan herb, cat whisker leaves, curcuma rhizoma, turmeric rhizome, and meniran herb. Example, next, herbal remedies for lowering blood sugar levels, bay leaves, sambiloto herb, cinnamon, and temulawak rhizome. The last summary, traditional Indonesian government's role is to ensure the production, distribution, and consumption of traditional health services are safe, have good quality and efficacy to be used as part of the integrated health system. Traditional health services could supporting achievement goal 3 SDG and UHC, specifically reducing mortality, MMR, NMR, CD, and non-NCD. It is necessary to strengthen the partnership and synergy of traditional health services. Indonesia will continue to support good collaboration with their other country. It requires commitment from the management of health service facilities to develop and strengthen traditional health services for control non-communicable disease. Thank you. Thank you.
Thank you, Ms. Lipka, for your presentation. Now, our next speaker will be present on the folk medicine knowledge of Lao use traditional medicine treatment diabetic in non-communicable disease condition. We are pleased to welcome Dr. Bunlươn Duongdean, Director General Institute of Traditional Medicine, Ministry of Health, Lao PDR. Dr. Bunlươn leads the Institute of Traditional Medicine with a strong academic background, holding a PhD in health science and a master's degree in public health from University in Thailand. complemented by a pharmacy degree from Vientiane. His extensive experience includes serving as Deputy Director General of the Institute of Traditional Medicine and Chief of the Traditional Medicine Division. He also acted as the Traditional Medicine focal point for the ASEAN Working Group. Please welcome Dr. Bullyan Duangduan.
Good afternoon, ladies and gentlemen. Thank you very much for inviting me and our staff to join a very important meeting today. On behalf of the Institute of Traditional Medicine, Lao PDR, I would like to share some our small topic research from the folk medicine in Lao PDR. We have so limited for the patient and so limited for the researcher and also the budgeting. Include my outline presentation. We have the first introduction, objective, methodology, result, discussion, and conclusion. You know, according to the Lao Party and state or policy or promote to use the Lao traditional medicine combination with the traditional medicine treatment disease. It's our right. For use for the potential of Lao medicinal exit to our country, become the cell and also the epidemic chronic disease also Ministry of Health, we have to use traditional medicine for the hospital also. But in the practical, it's quite difficult in Laos. For the non-communicable disease, for our highlight in this meeting is very important because diabetes is a condition with the body high than or more than the blood sugar level. This is our topic to come to share with you. For the background, also diabetes is a relative of the chronic metabolic the after million the world in the access to modern medicine very difficult in Laos. Modern medicine also because we have very far for the rural area for accessibility of the medicine. That's why the people of our country they use traditional medicine, but no scientific or no evidence. The objective we do it is we set the general objective to observe and document because we lack of a lot of the document for the look at the safety potential of the benefit of the sector of traditional medicine use diabetes patient. The special objective that is for our to the study the comparison with the blood sugar in the 90 patient before and after Lao TM, Lao traditional medicine capsule we give the patient take in 3 months. Because we don't have enough money for a long term, just the first start from 3 months. And also we to study the comparison the external symptom to happen with the patient and the kidney function and the before and after using Lao traditional medicine. And we analyze and statistic data and summarize report, public and disseminate. This is our objective. This is a concept. This is like easy to set the concept village station. We open to the patient from in Vientiane come to this station and testing A1C test urinatic etc. If we can do it. Because we want to know our folk medicine use formula this good or not. This is the method also It's easy. We have can do it. We study the observe non-intervention study, and as we said, the traditional medicine, chronic or community health in our center in Institute of Traditional Medicine. Then, after that, we correct 7 to 9 patients. The diagnosis of type 2 diabetes, and also data correction from the patient history, because we want to know who have the diabetes, the blood sugar we want to know also, and the type of the dose the traditional medicine we give the set up during the treatment, and observe the side effect of the compromise. The condition, the participant from the patient, we select the patient with the type 2, the patient who come to treatment and diabetes, also they have like the person who have 1 year or more, we selected. And also the participant by the signing of the information contact, and more than X year or older, not include gender, no problem. That's those who have the confident blood sugar A1C is more than 6.5%. Because we check the hospital, Mohoson Hospital, to help us to check this, and don't have the symptom like the bruise vision or numbness in the finger, or and toes, dry the toes and thirst, and the finger the urine of the close dry the urine, or etc. The patient who have the writing use traditional medicine agree to use. We said the name of the Tongxiang capsule, the capsule treatment, because we call with some company to produce this one. The absent in the patient is less than 18, and the patient with this such as heart disease, also with kidney failure, also we cannot accept it because of, and also the pregnant woman. For the research method, we also I already mentioned that the correct person whose history is very important, because we want to know the checks of the blood sugar. We check the blood sugar level in the laboratory in Mohoson Hospital, and they give the patient Tongxiang capsule or traditional medicine 400 milligram, and also during the treatment we have to strict for the control the patient who's diabetic according to the doctor instruction, and the checks of the blood sugar 15 days, and we check 15 days until the end of the hour. Then ask about the symptom. We record the symptom of the happen in the period, and the check of the among the blood sugars after use of 19 days or more than and also exam the analysis summary. This is our picture, so that our correct history after they come here to meet our center. This we set the formula, the blood sugar before, and the common herbs we use. We observe that the type of those of the traditional medicine used. Maybe in Thailand we have called what's Kimin San. And also the second one is we call in Laos name, common name is Yik Bo Thong, but in Thailand maybe Hak Ien Don, something like that. And the last one Hua Lin Chư, Het Lin Chư. It's popular in China too. This also we check our description from the folk medicine, habit, etc. in Laos. Actually, we have corrects from the nature. Himin and Yik Botong. If as in Laos, maybe someone knows in the Hak Yen Don. So because we said our common name is Yik Botong. Because in the leaf we cannot yik like a bobo sort. No, there is Yik Botong. We check all of this can treat the diabetes or reduce the diabetes. And the Ương Kam Phoi maybe the same in Thai name, right? Ương Ki. And this we allow traditional medicine research of the diabetes. We use the Kim San 300 and the Yik Botong 15 and Hetilincher 15 and the last one Ương Ki is 20. For we set the indication benefit they help the prevention and reduce blood sugar. That's very important for to treat with the compliance such as urine and number of the for blood vision also. We found that, and also we take 2 or 3 capsules after meal, 3 times a day. And during the course of the taking traditional medicine, if we taking the medicine, we check not stop we don't want the patient they want to stop the modern medicine, but we have to use combined. This is we set up our team, research committee, and also we discuss time to time, a week like that, and also we test safety use. This is a record from the beginning until use our product. The symptom also, we follow look at the symptom, and of course symptom the diabetes like the feeling also very feeling for history or need to more than use or bruise vision, or we check the symptom, lost weight or something like that. We collect from the beginning until after we use traditional medicine, Lao traditional medicine. This after that we for the general information 75 patient to believe about we use traditional medicine. Only separate woman and man, and this we compare before and after. Sugar level 18 to 120. Before we meet only three, but after that after we did 13. That means the sugar level is like sustainable. We compare the easy like this. Because of traditional medicine, we cannot use like the modern medicine. This also therefore for the H1C. Also, we have the set up after that we come to our table to look at this. This we check. This is some of 70 people, 70 diabetes. But we look at the for the blood pressure also reduced, and also kidney function. We found that quite like the recover This also a number of the external diabetes symptoms. Also, we check the before and after, like the number of food hand and the brush vision or nutrient of the approach, the and the various wood hearing or something like that we check. This is also a comparative. The example, the patient, one patient, maybe N9, we check one by one like that. This before it happened, but after that only 3 months it recover after we use this product. Let's compare from the Mohosot Hospital laboratory before and after, and if we look at the H1C, this come back to recover. That's a result of the case 19. The first problem, but now it's better. This is 19 also. They show the laboratory test results. Results of the case 60 also recover. This is some picture. Results of the case of 66. That's the study of Lao traditional medicine use is we can be the summarize. Just follow the. This is summarize. We have no time for all to explain to you. Back to the results. This that means the blood sugar improve. The advantage the first blood sugars reduced from the 118 to reduced to the 114. Average 60% in the patient. And also symptom of the improves. And also the effective this remind the case of the discomfort of 3 cases only. And the patient is satisfaction, the high infection during the accessibility to low cost and the cultural acceptance. Our discussion, this we have the effect, the sentence of the herb, domestic to the patient high glycemia, effective the limited the lack of the standard dose. It allows also we just knew for the number of the WHO. I also attend the strategy in Manila, not Manila, Manila, right? Yeah. And also the proper control group and the demand of the patient self-reporting and the cultural relevant, the traditional medicine aligned with the local the benefit of the patient, and also the recommendation the further of the clinical trial we should do. We should do. Depend on the budget. Depend on maybe we want to join with Thailand to how to do the research to be the scientific evidence more and more. It's not only Thailand, maybe Philippines. No, or Malaysia, because Coach Sud is my friend, but maybe join. The conclusion is Lao traditional medicine saw the promise of the supporting the diabetes management, especially in the rural area. However, the scientific validation of the standard are concerned to the negotiate the traditional practice into the national health care in the future. Thank you very much.
Thank you,
This support support our product in the future. This is our team and some patient in our photo to try to use our product or our research. Thank you.
Thank you, Dr. Bunleun, for your informative presentation about folk medicine of Lao PDR. And our next topic is the integrating tradition, the role of TNCM in managing chronic NCD in Malaysia. We are delighted to introduce Dr. Gan Feng Fang, Senior Principal Assistant Director, Traditional and Complementary Medicine Practice Section, Traditional and Complementary Medicine Division, Malaysia. Since 2017, Dr. Gan Feng Fang has served as the Senior Principal Assistant Director at the Ministry of Health Malaysia Traditional and Complementary Medicine Division. She holds a Master of Pharmaceutical Science in Chinese Medicine from Hong Kong Baptist University and a Doctor of Medicine. Prior to her current role, she was a medical and health officer. Dr. Gan Feng Fang has significantly contributed to publications like Research Priority in Traditional and Complementary Medicine for Malaysia 2024 to 2029 and Utilization of Traditional and Complementary Medicine in a primary care setting, as well as technical report and guideline on herbal therapy and Silotara. Please join us in welcome Dr. Gan Feng Fang.
Good afternoon, ladies and gentlemen. Thank you very much for giving me the opportunity to share with you all today the initiative undertaken by the Ministry of Health Malaysia to integrate the role of TNCM in managing chronic NCDs in Malaysia. This is the outline of my presentation today. First of all, I would like to give a very brief overview of TNCM in Malaysia. In the Malaysian context, the TNCM Act 2016 defines traditional and complementary medicine as a form of health-related practice designed to prevent or treat or manage ailment or illnesses or preserve the mental or physical well-being of an individual, but it excludes medical or dental practices used by a medical or dental practitioner respectively. According to the statistic from the National Institute of Health, in 2022, almost 55% of Malaysians have ever used TNCM services. Traditional Malay medicine is the most widely utilized form of TNCM in Malaysia, followed by traditional Chinese medicine and traditional Indian medicine. It is also found that the main reason for utilization of TNCM services are for the purpose of health
ถ้าอย่างนี้
maintenance
ก็ไม่โดน
and
แดดอะไรมากพี่ก็คิดว่าไป
rehabilitation
ทำสวน
treatment.
โอเคอย่างนี้แฮปปี้สดชื่น
This is the governance of TNCM in
ค่ะขอบคุณมาก
Malaysia.
ค่ะ
The Ministry of Health governs practice and practitioners, research and also products, while the education sector is under the purview of the Ministry of Higher Education and Ministry of Human Resource.
มาเลเซียพูดอยู่
To promote safe, quality and effective TNCM services, several initiatives were taken by the Ministry of Health to facilitate the integration of the TNCM into the national healthcare system. This has been achieved through the development of national policies, regulatory frameworks and strategic plans in the field of TNCM. Malaysia has a national policy on TNCM which states that TNCM shall be an important component of the healthcare system and it will coexist with modern medicine to enhance the health and quality of life of all Malaysians. The National TNCM Blueprint 2018 to 2027 is a 10-year strategic planning initiative that was developed to facilitate the growth of TNCM in the nation, with the aim to promote quality and safe TNCM practices and products. It also will facilitate the identification of the health, economy, and social benefit of TNCM. 2016 marked a momentous event in the development of TNCM in Malaysia, as the TNCM Act 2016 was officially gazetted and its regulation connected therewith in 2021. There are currently 7 recognized practice areas under the TNCM Act 2016, namely traditional Malay medicine, traditional Chinese medicine, traditional Indian medicine, homeopathy, Islamic medical practice, chiropractic, and osteopathy. The enforcement of TNCM Act 2016 represents a huge stepping stone towards professionalization of TNCM practice. One of our initiatives towards professionalization and standardization of TNCM practitioners is official registration and licensing. Registration of TNCM practitioners commenced in year 2021. As you can see in this table, as of the first week of April 2025, a total of 16,051 TNCM practitioners have registered with the TNCM Council. And out of this, approximately 50% of the registered practitioners practice traditional Chinese medicine, followed by traditional Malay medicine and Islamic medical practice. Next, we will go to the integration of TNCM services into the national healthcare system. TNCM has been incorporated into the national healthcare system since year 2007 with the introduction of TNCM services such as traditional massage, acupuncture, herbal therapy as an adjunct treatment for cancer, Shirodara, external basti, and Wellman therapy as selected public or Ministry of Health hospitals. In 2012, TNCM services were extended to the primary health care clinic with delivery of postnatal care service in the comfort of patients' own home. In the public sector in Malaysia, there are currently 15 hospitals and 158 clinics that offer selected TNCM services alongside modern medicine, catering for specific health conditions, as you can see in this slide. Currently, we are working on the pilot project on Wellman therapy for autism and cerebral palsy to expand our TNCM services into our public facilities. The TNCM division has also developed several guidelines to guide the provision of TNCM services at Ministry of Health Hospital, as well as to ensure that the services provided are safe and of quality. These guidelines will be reviewed over time and updated according to the latest developments and evidence available. Next, we move on to the TNCM products. The registration of TNCM products in Malaysia began in year 1992 under the purview of the National Pharmaceutical Regulatory Agency under Ministry of Health. Similar to conventional pharmaceutical products, TNCM products are subject to criteria for regulation, surveillance, pharmacovigilance, licensing, and adverse drug reaction reporting. The drug registration guidance document is the main reference for drug registration in Malaysia. As of October 2023, about 13,000 TNCM products are registered with the Drug Control Authority. Local and international references, including respective pharmacopoeias, are used as references in the registration of TNCM products in Malaysia. Next, I would like to share about the initiative undertaken by the Ministry of Health Malaysia to develop a robust evidence base for TNCM research in the country. TNCM in Malaysia is moving towards evidence and value-based practice. As stated in the TNCM Blueprints 2018 to 2027 in both our healthcare as well as our economic and social cultural blueprints. This is also in line with the National Health Research Priorities for Malaysia's current National Development Plan, the 12th Malaysia Plan, to optimize the contribution of TNCM R&D towards healthcare goals. TNCM research in Malaysia is often conducted by a varied group of population, including the government agencies, educators, and the industry itself. These are among the government agencies that often embark on TNCM-related research. This TNCM research roadmap delineates a strategic plan for advancing TNCM research in Malaysia. It started with identification of existing gaps, which include lack of research advisory body specific to TNCM, concerns on the conduct of TNCM research in terms of research protocol development, standards and training of researchers, and quality related to products and practice standardization. In order to address the areas of concern relating to all these gaps, we have implemented several initiatives to overcome this gap. These are the initiatives implemented, including publishing of the framework on TNCM research in Malaysia in year 2022, as well as establishing the TNCM Research Advisory Committee, the TNCM Research Priorities 2024 to 2029, which aims to set research direction and gather evidence for advancing TNCM towards achieving universal health coverage in Malaysia, was launched in late 2024. By fostering robust research and evidence generation in TNCM, Malaysia aims to become a center of excellence for TNCM research in the future. This is the framework on TNCM research in Malaysia. This guideline is intended to facilitate practitioners, researchers, academicians, authority bodies, and TNCM industry players who are interested in designing, conducting, and evaluating TNCM research in Malaysia. It encompasses general and specific consideration required for conduct of TNCM research while complying to the present policies and guidelines in the country. This is the guideline on herbal medicine research. It was launched together with the framework on TNCM research, and it focused on bridging the gap between preclinical and clinical research on herbal medicine. As of May 2025, TNCM division under the Ministry of Health has so far undertaken 23 research projects covering various aspects such as TNCM practices, services at Ministry of Health facilities, knowledge and attitude, as well as utilization and needs of TNCM. These studies have involved patients at Ministry of Health, healthcare facilities, general public, TNCM practitioners, university administrators, and our ASEAN counterparts. The list of those research projects is as shown in this slide. Some of the studies are related to NCDs, and the most recent research technical reports can be accessed from our official TNCM division website. As for research collaboration, TNCM division has worked with 4 agencies within the Ministry of Health, namely National Institute of Health Clinical Research Centers and Malaysian Health Technology Assessment Section, or MATAS. As for collaborators from outside the Ministry of Health, our TNCM division has partnered with 8 agencies across several ministries as well as non-governmental organizations. Policy-making decision in Malaysia is very much influenced and dependent on availability of scientific evidence, especially through the health technology assessment, or in brief HTA, and technology review, or TR. The HTA is a systematic evaluation of properties, effects, or other impacts of healthcare intervention. Based on the number of TNCM-related HTA and TR conducted since 2005, it is noted that the greatest number of TNCM-related HTA and TR was conducted in year 2015 and 2016 respectively. Majority of TNCM-related HTAs and TRs were conducted on topics relating to traditional Chinese medicine and traditional Malay medicine. TNCM division has requested and provided technical input to the MATAS on HTA and also TR relating to TNCM practices, encompassing topics such as for traditional massage, acupuncture, traditional postnatal care, spiritual therapy, homeopathy, Shirodhara, and many others as depicted in this slide. There are altogether 15 TR, 2 HTAs, and also 1 Cochrane review that have been conducted so far. The indications that have been reviewed are mainly related to musculoskeletal pain, mental disorders such as insomnia, depression, anxiety, and stress, symptoms relief in cancer patients receiving chemotherapy, as well as for post-stroke patients. A few studies have also been conducted in collaboration with different departments within the Ministry of Health. For instance, a double-blind RCT to assess effectiveness of acupuncture as a complementary treatment among opioid dependence patients who are on methadone maintenance therapy, National Health and Mobility Survey 2015, and also use of TNCM herbs among type 2 diabetes patients. Leveraging the advent of traditional medicine informatics and information digitalization, the Ministry of Health, together our strategic partners, have been working on the digitalization of traditional Malay knowledge on medicinal plants. The project, which started more than 10 years ago, is a testament to our combined efforts for safeguarding and preserving invaluable traditional knowledge and cultural heritage of the Malays. To date, this project has yielded multiple publications documenting the use of herbal plants in traditional Malay medicine, some of which are depicted in this slide. Moving forward further to enhance TNCM research in Malaysia, we have developed the TNCM research priorities specifically for Malaysia with the intention to set direction and building the body of evidence for advancement of TNCM towards achieving UHC in Malaysia. For a more wholesome and inclusive approach, while developing these TNCM research priorities, the Ministry of Health had conducted a series of engagement sessions with a diverse group of stakeholders that are involved in TNCM-related matters in Malaysia. They include various other regulators within Ministry of Health, government agencies involved in regulating various other perspectives of TNCM industry, public universities and private higher education institutions, as well as TNCM practitioners. The key research domains focus on TNCM practice evaluation, TNCM product development, innovation, and also education needs of TNCM. Each identified domain is vital for advancing TNCM in the country, enhancing integration into modern healthcare, and also to improve the quality, safety, and efficacy of TNCM practices and products. The research priorities in TNCM for Malaysia covers research areas for communicable diseases, non-communicable diseases, and also oral health diseases that were included in our National Health Research Priorities 2021 to 2025. And for TNCM research priorities, there are 7 indicative priorities for NCDs that are included in this, which include endocrine and metabolic diseases, cardiovascular diseases, neurodegenerative diseases, cancer, maternal health issue, tobacco and mental health disorder, for example, anxiety, depression, stress, insomnia, and addiction. In order to identify the gap for TNCM research in Malaysia while developing the TNCM research priorities, literature review has been conducted for published articles in English for the past 10 years. The literature review for the NCM practice evaluation domain focus on the 7 recognized practice area under the NCM Act 2016. As you can see in this table, for the past 10 years, there were about 35 studies related to NCDs that have been conducted in Malaysia, with the majority on traditional Malay medicine and Islamic medical practice. While the literature for the TNCM product development domain, it focused on the 18 herbs under Malaysia's National Key Economic Area or NKEA. There are altogether 116 studies related to NCDs that have been conducted in Malaysia, and majority of them are preclinical studies. Lastly, it is about our way forward towards an evidence-based TNCM in Malaysia. Proactive measures have been taken by the Ministry of Health to create a more conducive and supporting environment for TNCM in Malaysia, starting with regulation of TNCM practice and practitioners, regulation of products under the drugs and cosmetic regulation, establishing stronger higher education support, whereby at present we have various levels of TNCM programs offered, such as for TCM it is up to PhD, traditional Malay medicine is up to diploma, bachelors in homeopathy and chiropractic. Subsequently, the development of guidelines for conduct of TNCM research in Malaysia. At present, the Ministry of Health is working on regulating TNCM premises in Malaysia. This is our future outlook. With all the initiatives in place, we truly hope to change the facade of TNCM research in the country through a few initiatives, including increasing the number of high-quality TNCM research, approval of more TNCM-related research protocols, increasing more experts on TNCM research, as well as to provide a wider and stronger evidence base for future policy decisions related to TNCM in the country. At the same time, we are working towards increased training and capacity building for TNCM research, improved infrastructure for TNCM research, and additional funding. That's all my sharing for today. I thank you all for your kind attention.
Thank you, Dr. Gan Fen Phang, for the informative presentation from Malaysia. Our next speaker will share insight on traditional medicinal knowledge and research on the management of diabetes in Myanmar. Please welcome Dr. Susudaway, Director General, Department of Traditional Medicine, Ministry of Health, Myanmar. Dr. Susudaway is a distinguished medical professional with over 33 years of experience in medical service, public health, and policy making. She holds a Bachelor of Medicine, a Bachelor of Surgery, and a Master of Public Health. Prior to her current role, she served as Medical Superintendent at Yangon Children's Hospital and Mandalay General Hospital. As Director General of the Department of Traditional Medicine, Dr. Susudaway is dedicated to integrating traditional medicine safely and effectively into Myanmar national health care system. Please welcome Dr. Susudaway.
Good afternoon all. Thank you. I would like to speak the traditional medical knowledge and research on the management of diabetes mellitus in Myanmar. In Myanmar, traditional medicine is an and valuable national heritage developed within the context of Myanmar history and in correlation with the local natural environment, climate, culture, tradition, and benefit of from a unique medical system. It is based on the Myanmar people's understanding of health and disease, incorporating traditional medical knowledge, experience, and practice. Most of the people rely on traditional medicine for the treatment of various diseases for generations and becomes a distant entity as a delicate, useful, and important of community health in preventive, curative, and rehabilitative aspects. It is promoted scientific research into medicinal plants and traditional medicine used in Myanmar. World Health Organization prioritizes 5 non-communicable diseases, including cardiovascular disease, cancer, mental health, chronic respiratory disease, and also diabetes. It's widely recognized diabetes mellitus is one of the major public health challenges in the 21st century in low and middle-income countries. Diabetes mellitus among the top 10 leading causes of death and one of the biggest world health problems with high incidence and mortality. It is a chronic progressive metabolic disorder characterized by persistent hyperglycemia arising from defect in insulin secretion, insulin action, or both. Most patients visit in our traditional medicine hospital with hemiplegia patients with comorbid disease such as hypertension and diabetes mellitus. So patients are needed to control their blood pressure and blood glucose level. We emphasize the control the blood glucose level. For controlling blood glucose level, traditionally we use traditional medicine formulation and as well as how we formulate are widely. There were many studies on diabetes mellitus in this study clinical trial in systemic review on type 2 diabetes mellitus by traditional medicine in Myanmar. To evaluate the status of traditional medical knowledge and application for clinical research on diabetes mellitus, to conduct systemic review on clinical trial of traditional medicine on patients with type 2 diabetes mellitus in Myanmar, to assess the anti-hyperglycemic effect of Myanmar traditional medicine on type 2 diabetes mellitus, to apply systematically and clinically research of traditional medicine on type 2 diabetes mellitus. It is our objective. Most of the research use the clinical study of traditional medicine on diabetes mellitus or published paper, implementation research reports of Ministry of Health Myanmar and master degree dissertation of University of Traditional Medicine Myanmar. Study design and systemic comprehensive review by descriptive study design and selection criteria only clinical study traditional medicine research on type 2 diabetes mellitus during 2010 to 2024. Literature study and animal studies are excluded. The analysis the following data items characterized of all 8 clinical studies on traditional medicine were collected and assessed. We review the 7 of 8 studies were the same 8 studies. 7 of 8 studies. 7 of the 7 8 hospital based before and after clinical study design except 1 comparative study. All our ethical issues were approved in all studies, and patient selection criteria and intervention of studies were according to the WHO diabetes mellitus guideline. All studies were approved by Institutional Relevant Ethical Review Board. That is our research for diabetes mellitus. In 2010, using the traditional medicine formulation 28. Its ingredients 9 plus and 1 minerals. And number 2 researcher is Women 2012, combined 20 translation formula from 27 and traditional medicine formula 35. Number 10 research is Chonanda Kai 2016. Number 4 researcher is Kainte Su Tre 2017. Number 5 research is Momo Kai 2018. Number 6 researcher is Tanda Kai at 2018. Number 7 researcher is Nila Wen at 2018. Number 8 researcher is Lai Lai Mien at 2022. In discussion, all studies were done baseline examination and laboratory investigations such as serum creatinine, urea and liver function tests and pre and post intervention. Both fasting blood sugar and 2-hour fasting blood level were assessed in 5 studies and fasting blood sugar in 3 studies. One study, Women 2012, was systematically analyzed on diabetes patients with polyuria, polydipsia, polyphagia, itchiness, peripheral neuropathy, blurred vision, and relief after treatment. In my traditional medicine concept, traditional formulation are contribute to the presence of the phytochemical component which could act synergistically and independently to enhance the antibiotic activities, anti-diabetes activities in the presence of its hot, bitter, and pungent taste. Those traditional medical formulations, except to have extras, are national formulation and widely used in traditional medicine hospital to traditional medicine clinic and township level officially. The anti-glycemic effect of traditional medicine formulation and hardware were significantly proved. As I mentioned above, Myanmar traditional medicine is national heritage and flourished over thousands of years. A total of 135 ethnic groups in Myanmar and regard natural resources as essential to their culture and well-being. A large number of medical post newsletter, Parabek, a traditional Myanmar fooding book, Stone Inspiration, pamphlet were describing the effect on the human body and their use in the diagnosis and treatment of disease. For developing the traditional medicine knowledge in both documenting, preserving website of traditional medicine, the Department of Traditional Medicine, integrating it into modern practice. For knowledge sharing, production, and maintain the traditional medicine knowledge yearly by celebrating Myanmar Traditional Medicine Practitioners Conference and Myanmar Traditional Medicine Seminar, and also Traditional Medicine Research Congress at University of Traditional Medicine yearly. There is a lot of people for knowledge sharing and protection. There's a celebrated annual Myanmar Traditional Medicine Practitioner Conference and Myanmar Traditional Medicine Seminar at Naypyidaw. The use of traditional medicine in the treatment of diabetes mellitus in Myanmar, that it has been well accepted and most people believe in it deeply. The findings will provide and support to traditional medicine product practice, principles and practitioners for the improvement of diabetes care service. Traditional medicine practitioners need to further upgrade the knowledge and skill in the light of current understanding and development of modern care for patients with diabetes. Knowledge-based and formulating national policy and strengthening to do research of traditional medicine on their quality, efficacy, and safety. There are my reference. Thank you very much for your attention.
Thank you, Dr. Susudaway, for sharing the information from Myanmar. And next, we will next presentation for this afternoon is on the determination of nutritional profile, bioactivity, and probiotic potential of rice wine and the fermented lie left over from the Cordillera Autonomous Region using in vivo model, we are delighted to introduce Dr. Ma Teresa Ingenio, Director General of the Philippine Institute of Traditional and Alternative Healthcare, or PITAS, of the Philippines. Dr. Teresa became the Director General of PITAS in April 2024, bringing with her 34 years of intensive government healthcare experience. Her background includes leadership roles at Medical Center Shift 2 and Shift of Hospital 3 at the OH Pagate Treatment and Rehabilitation Center, as well as Chief of Hospital 2 at the OH Mariano Treatment and Rehabilitation Center. Dr. Teresa holds a Doctor of Medicine degree and postgraduate course in addictions. At PITAS, she is dedicated to improving policy for traditional, complementary, and integrative medicine practice, enhancing organizational structure, and prioritizing high-impact TCIM research. Please welcome Dr. Ma Teresa Ingenio.
Thank you. Good afternoon, everyone. By this time, I think we already have like an information overload. So, I'm from the Philippines, and at the onset, I'd like to invite everyone. There's going to be another ASEAN conference in Manila next month. So, kindly wait for the official invite. I think it's going to be out. We're sending it to the ASEAN Secretariat this week. So hope to see you all there. So I think I'm the newbie here. I was on board the Philippine Institute of Traditional and Alternative Medicine only last year. I'm barely 14 months in this post. And I'd like to apologize as well because I think there was like a misunderstanding or a confusion with regards to the template of the report. So I wouldn't be able to present like a template, an overview, but at the onset, I'd like to tell everyone that there was already an enabling law that was enacted. It's called the Traditional and Alternative Medicine Act, I think for late 1990s, I think 2000, year 2000 or 1997. But sadly, the growth or the progress of TCM in the Philippines has not been as fast as it should be. I think we have had the same concerns. It's always really the battle between the allopathic, the Western, and the traditional. So the trust, we're slowly getting it, but not as fast as it should. And the one concern with the law is that there was no regulatory powers that was provided, so which is very crucial really to ensure safety and quality both for the practice in the practice of TCM. But for the products, there is a law, different agency as well. So I'd like to start really by saying that in the Philippines, non-communicable diseases, which includes cardiovascular diseases, diabetes, cancer, chronic respiratory conditions, and neurodegenerative disorders such as Alzheimer and Parkinson's disease, pose a growing challenge to the public health and quality of life in the Philippines. We advocate for an integrative health approach that leverages traditional and complementary medicine in addressing these conditions through culturally grounded, evidence-based strategies aligned with PITAC, our agency's research priority agendas. We have 4, which includes the cluster 1 is development and validation of natural health products. Cluster 1 would be conservation and of heritage and documentation. Cluster 2 would be safety, efficacy, and quality of research and development of natural products. Cluster 3 would be clinical research on TCM practices. And Cluster 4 would include policy systems, sociocultural, and standards in research. So my presentation for today, I'd like to add as well that by bridging heritage and innovation, our agency or the Philippines aims to offer holistic and accessible options for prevention, management, and supportive care across the spectrum of NCDs. My presentation, sorry, I think the title was not updated. We submitted it few days before we came in. So the title of the research, this is actually I think 2 researches. Ancient Brew, Modern Cure, Exploring Philippine Rice with Tapoy for Gut and Brain Health. So this presentation delves into research studies on tapoy, a traditional Filipino fermented rice wine known for its unique microbial and biochemical characteristics. By exploring its fermentation process, nutritional potential, and cultural relevance, we aim to highlight tapoy as both a subject of scientific interest and a valuable part of our heritage. Tapoy, a traditional rice wine from the Cordillera region, is more than just a cultural beverage. Rich in antioxidants and phenolic compounds, it has long been consumed by indigenous communities. Recent studies sparked interest in its potential neuroprotective properties. This research was developed to explore whether tapoy and its byproducts could support cognitive health among older Filipinos, particularly those at risk for dementia. I think in Thailand, you would call this sato, rice wine. Sato or cow, yeah. In Malaysia, it's tapay. It's tapay. In Indonesia, I think it's called brem. Is it brem? Yeah. In Lao, is it lao? The rice wine? Okay. Tapoy, as mentioned earlier, is a traditional Filipino rice wine, particularly produced in the northern Philippines. Oh, sorry. I'm supposed to do this. Okay. It's a traditional Filipino rice wine primarily produced in the northern Philippines, known for its rich antioxidant and phenolic content, fermented through indigenous techniques using molds and yeast. It has long been an integral part of rituals and communal celebrations. Despite its cultural significance, the nutritional and medicinal potential of tapoy remains largely underexplored in scientific literature. Fermented rice, a staple in many indigenous traditions, holds untapped potential as a functional food, rich in bioactive compounds that may support gut health, cognitive function, and overall wellness. Studying it bridges ancestral wisdom and modern science to uncover sustainable, culturally rooted health solutions. There were 2 completed research projects investigated and which investigated tapoy. The first study characterized its nutritional profile, bioactivity, and probiotic potential, including its fermented rice byproduct or the lees through in vivo models. The second study examined the association between regular consumption of tapui and lees with the prevalence of Alzheimer's disease and early signs of dementia, suggesting potential neuroprotective effects. These findings highlight tapui as a promising functional food with cultural and biomedical relevance. I think study number 1 was conducted 2019 and the following year was the second one. So for the first study, the title is Determination of the Nutritional Profile, Bioactivity, and Probiotic Potential of Rice Wine and the Fermented Rice Leftover, or the lees, from the Cordillera Autonomous Region using in vivo model. The general objective of the study is to evaluate the biofunctional health properties of tapui wine and its byproduct, tapui lees, both produced through traditional and standardized fermentation methods, using C. elegans as an in vivo model. Specifically, the research aims to assess the neuroprotective and neurotherapeutic potential of tapui and lees, as well as to determine their antioxidant properties, with the goal of exploring their possible role in mitigating neurodegenerative conditions. To begin, they standardized the fermentation process to ensure product consistency. And then a detailed analysis was performed using GCMS to identify antioxidant compounds, followed by in vitro assays to measure antioxidant activity. Tests were also run for shelf life and microbial stability to ensure safety. The findings confirmed the presence of various phenolic compounds with high antioxidant activity. Importantly, tapui maintained its stability through initial storage, suggesting that it could be developed as a functional food product with a reasonable shelf life. Experimental results showing the C. elegans model revealed that both tapui wine and its lees possess notable biofunctional properties, including antioxidant activity, enhanced stress resistance, and neuroprotective effects. Interestingly, lab-prepared samples demonstrated comparable efficacy to traditionally fermented field samples, supporting the potential for scalable production. Across multiple assays, tapui lees consistently outperformed tapui wine, exhibiting more robust and reliable health benefits, positioning the lees as a particularly promising functional ingredient for further development. We go now to research number 2, the title of which is Association Between Consumption of Fermented Rice Wine, the tapui, and lees with Alzheimer's disease and early signs of dementia. This second research will share about the progress and goals of the research, exploring the effects of tapui on brain health in older adults in Benguet province. That's also in northern part of the Philippines. So as a recap, year 1, the first study, focused on the laboratory-based identification and characterization of the bioactive components of tapui and its lees. While the second study, the research transitioned to a community-based setting where we investigated the effects of daily tapui consumption on cognitive function and mood among older adults. Additionally, the safety, tolerability, and acceptability of tapui was also evaluated as part of the regular dietary intake. Okay. The study was conducted across 9 municipalities in Benguet and Baguio City, capturing both rural and urban contexts within the Cordillera region. The study population consisted of adults aged 45 years old and older who had been residents of their respective barangays for at least 10 years, ensuring a cultural familiarity and long-term dietary exposure. A total of 1,484 participants were selected using systematic random sampling to ensure representativeness and to minimize selection bias. The participants consumed 30 ml, I guess that's about 2 tablespoons, of tapoy daily for 6 weeks. Cognitive and emotional well-being were assessed using 3 standardized screening tools. Number 1 is the MOCA, or the Montreal Cognitive Assessment, to evaluate general cognitive functioning across multiple domains such as memory, attention, language, and visuospatial skills. Number 2 is the MMSE, or the Mini Mental Status Examination, for assessing orientation, registration, attention, recall, and basic language functions. And third is the GDS, or the Geriatric Depression Scale, to measure emotional well-being and screen for depressive symptoms among older adults. To understand contextual health influences, data on environmental exposures, for example, proximity to mining areas, pesticide usage, and water source quality were collected through structured interviews, and in selected subsamples, biological samples were obtained as well. Toenail clippings were collected for trace elements using total reflection X-ray fluorescence to assess potential heavy metal exposure. Blood samples were drawn to evaluate markers such as C-reactive protein, or CRP, and lipid profiles. These complementary assessments provided insights into confounding variables that may affect cognitive outcomes and overall health. For the limitations, the study had several limitations. First, no placebo or control group was included due to cultural considerations and ethical concerns in the participating communities. Second, the intervention period was quite or relatively short, that is lasting only for 6 weeks, which may limit the observation of long-term effects. And lastly, only a subset of participants underwent fMRI scans and biomarker testing, which may constrain the generalizability of the neurobiological findings. For the key results, we observe a statistically significant improvement in MOCA, that's the Montreal Cognitive Assessment Test. The scores, in MOCA scores after the intervention, especially in attention, recall, and visuospatial domains. While the mini mental status examination gains were modest, they were more pronounced among individuals with lower baseline scores. Beyond cognition, participants reported improvements in sleep, mood, and social interactions. The GDS scores, or the Geriatric Depression Scale scores, reflected a reduction in depressive moods, highlighting TAPWI's potential to support emotional well-being. In terms of safety, no serious adverse effects were recorded during the intervention. A small number of participants reported minor side effects, such as dizziness or mild stomach discomfort, all of which resolve spontaneously without medical interventions. Overall, participants expressed a high willingness to continue tapui consumption, indicating strong acceptability and perceived benefit of the intervention. So for the conclusion, the findings would suggest that tapui holds promise as a complementary intervention for community wellness programs aimed at mitigating age-related neurocognitive decline. Beyond its functional health benefits, the study underscores the importance of integrating traditional knowledge with modern health frameworks, highlighting how Philippine ethnomedicine and food heritage can offer innovative solutions to contemporary health challenges. This work advocates for a more inclusive and culturally rooted approach to public health and aging. In closing, this study not only sheds light on the untapped health potential of tapui and its byproducts, but also reaffirms the value of our indigenous knowledge systems. By bridging traditional practice with modern scientific inquiry, we take a meaningful step towards inclusive, culturally responsive healthcare solutions. As we continue to explore the rich intersections of ethnomedicine and evidence-based research, may we also strengthen our commitment to preserving and uplifting the wisdom embedded in our local food heritage for the health and well-being of future generations. Good afternoon, everyone, and thank you for having me here. Thank you so much. Before I close, I'd like to reiterate the invitation for next month. It's going to be the virtual. There's going to be 2 events. One is on a virtual platform, which is going to happen on August 12. And the face-to-face will be August 14 and 15. So we will be shouldering for the plane fare, the accommodation, and the meals. So that's, thank you again.
Thank you, Dr. Teresa, for your presentation and introduce the interesting event, the 2 events. We are looking forward to join you. And now we will now have a short refreshment break, and maybe we please return for 10 minutes. Please return in 3 or maybe 3:35. Okay, maybe we have the short break.
Singapore is one of the few island city-state, small with an area of about 730 square kilometer. So it's really small. From east to west, it's only 50 km, and north to south is only 27 km. And we have 5.5 million population, and from that you can see that we are really concentrated. So our lands had to be utilized properly. So growing herbs is not the priority at all. But despite that, in Singapore, we have more than 2,200 species of plant. Most of the plants are used to beautify Singapore and also to increase the oxygen level for Singapore. So therefore, all our herbs are imported, raw herbs or other types of herbs. I think I will explain a bit later. So what I would like to share with you is the recent and the future development of traditional Chinese medicine in Singapore. There won't be scientific or research presentation, but perhaps maybe I can share with you why and how we deal with health and healthcare in Singapore. So the health and healthcare approaches are guided by four key philosophies. Number one is preventive health is better than treating illness. Yeah, so this is inconsistent with preemptive treatment or 治胃病, okay, which is treat a disease before it appears. But treatment providers should be both clinically effective and cost effective. And individuals should take personal responsibility for their health. Cannot depend on government, but the government will ensure all will receive adequate and appropriate healthcare access when you need it. So these are the philosophy, and this is how we provide healthcare in Singapore. It's a mixture of public, private, and community care organization combined together to provide care. So health promotion, okay, the color represent, okay, the gray, is it gray on this? Oh yeah, okay, gray is provided by the government, whereas oh, mine is pink here and this side is beige. Okay, so the other color is supposed to be provided by the private sector. So for health promotion, government take charge of this because they want to make sure that everybody stay healthy so that you don't come and utilize the resources. But for the primary care, most of them are seeing GP in the private sector. So the same for TNCM in the primary care. Polyclinic, as you can see, the percentage is probably about 20%. But anything that is acute, you go to the public hospital, 80%, ambulance was sent to the public one, private one about 20%. Intermediate care is that, for example, you get admitted for a stroke, acute stroke, you stay one week, then after you go to the community hospital. So this is, we have the government-owned community hospitals and as well as what we call the community care organization owned community hospital. But when we come to the aged care services, we need a mixture of all three stakeholders to combine our effort in providing them. So this is just an overview. We have many challenges, but one of the challenges that we are facing is rapid aging population with a declining support ratio. So by 2030, 1 in 4, in fact now, 1 in 5, 2025, 1 in 5 is age 65 and above. So in 5 years' time, 1 in 4 will be 65 and above. And the senior support ratio will drop from 3.5 today to 2.1. So that is a big issue. So that's why we try to make sure that everyone stay healthy and utilize the resources, even though you can live longer. So we have changed our priority, and we have gone so-called beyond healthcare 2020, which is emphasizing on accessibility, quality, and affordability. Now we move beyond healthcare 2020, beyond healthcare to health, and beyond hospital to community. So if you are sick, get treated in the community, don't come to the hospital if possible. Then beyond quality to value. So how do we handle this? So we have started our what we call the Healthier SG plan, and we have mobilized family doctors to improve preventive care, putting health in the hands of the residents and building health ecosystem and partners and strengthening enablers. I don't think I have time to go through this. Let me just go straight to how we handle traditional medicine in Singapore. All these years, since 1920s or after our independence in 1965, Western medicine is a mainstream medicine. Traditional medicine plays a complementary role. Really complementary in the sense that, as I mentioned earlier, Singapore is small. You call an ambulance, you can reach the accident and emergency department in 5 to 15 minutes. We have at least, we're coming to about 10 big hospitals. So the mainstream medicine is Western medicine. So the TM is really playing a complementary role. So we have traditional Chinese, Malay, and Indian medicine. As you can see, the biggest group is the TCM group with 800 establishment, followed by Malay and Indian, or maybe followed by the traditional Indian medicine and the Malay medicine. Among the, we do what we call National Population Health Survey. We did it in 2007, 10, 13, 19, and in 2022, we have found that at least about 20% of our population use traditional medicine, especially Chinese medicine, between the age of 40 and 60. And among this group, about 2 in 5 use both TCM and Western medicine for the same condition. And they use traditional Chinese medicine for example, chronic aches and pain, including headaches, acute minor injuries, or keep themselves well, right? So they are using our TCM in this manner. Of the 3 traditional medicine, we only regulate traditional Chinese medicine practitioners. And the regulation started in 2000. That was because at the time there were already more than 1,000 TCM practitioners. And TCM practice in the earlier years may not be totally safe. For example, like acupuncture, moxibustion, cupping, and the herbs can all potentially cause injury. So at the time, the government decided that yes, it's about time to regulate them because there's critical mass, and it's also like we're using the risk-based approach. Other traditional and complementary medicine, based on what they have described, they are relatively safe and the number are small, so we're not regulating them. So who are the governmental body regulating TCM? Okay, Ministry of Health, or under Ministry of Health. Within the MOH itself, we have 2 branches, traditional and complementary branch. I'm the head of that branch. And that branch, this branch formulate and implement policies on traditional and complementary medicine. So there are regulation and development and so on. We have another branch called Surveillance and Enforcement Division. So let's say if you have a non-TCM practitioner practicing TCM, if you're being notified, this branch will be activated and they will go down and take action against non-TCM practitioner practicing TCM. We have a TCM practitioners board. So we regulate the practitioners. So as a head of the TNCM branch, I become the registrar of this TCM practitioner board. So we started registering them in 2000. Initial few years was by grandfathering, but subsequently is by completion of a recognized course and take a licensing exam. So we have about 3,500 practitioners, of which about 3,200 TCM practitioners. The 260 acupuncturists are now Western medical or dental doctors. So they can take a 2 years course, pass the licensing exam, become acupuncturists. They can't prescribe herbal medicines and so on. But TCM practitioners can do anything that's under the Act. So to register as a TCM practitioner in Singapore, you need to graduate and hold an approved qualification and pass a licensing exam. SCRE or SARE, depends on whether you are for TCM or acupuncturist registration. So we have two local institutions that offer TCM education, Singapore College of TCM, Institute of Chinese Medical Studies, and Nanyang Technological University. I think it started about 15, we have 15 batches graduated already. It was a combined, it's a double degree program, 5-year program. They get a Bachelor of Science degree from NTU, Nanyang Technological University, and Chinese medicine degree from Beijing University of Chinese medicine. But this has been sunset. We have started a 4 years course. So the first batch will be graduating in 2028 with existing batch of 5-year degree course. So in 2028 we have more TCM practitioners registered if they pass that exam. So in addition to the local degree, we also recognize 7 degrees. As you can see, they're all from China. That is the current situation. There will be another TCM university that we are going to recognize soon, and the rest are not. Okay, Health Science Authority regulate the traditional medicine products. So TCM Practitioner Board regulate practitioners and these Health Science Authority products. So the services and clinics are not regulated as of now. Okay, there's no licensing requirement for raw Chinese medicinal materials or traditional Malay or Indian medicine. So they can just import like plants. But they still have to comply with certain legislative requirements, right? Make sure that there's no no toxic heavy metals, no poisons and prohibited substances. Then you can come in. Then we have the Chinese proprietary medicine. There are more than 12,000 listed in Singapore, imported by maybe coming to 360 licensed CPM dealers. They approved their registration not because they are efficacious, it's just that they are not poison. But even after you get, we can buy all this over the counter. You don't need any prescription. But there will be post-marketing surveillance, feedback, and so on. So anything that's found unsafe will be taken down from the list. Okay, where can they find TCM practitioners? Okay, private clinics. They run their own. Or Chinese medical halls where they sell herbs, and there may be rooms for the TCM practitioners to rent the room and provide the TCM consult and treatment. And of course, when they come out, they may want to buy herbs, and the medical hall will benefit from it. We have big charitable TCM organized clinics like Da Zhong, Tongji, Zhonghua, and so on. These are the big ones. But acupuncture has been provided in Western healthcare institutions since 2005 and 2007. Only acupuncture, no herbs in a public healthcare institution. But things may change in the coming years. So I thought I'd just go through what we have. I mentioned earlier, in 2000, we passed the act and formed the board and start to register them based on the grandfathering methods. But from 2004 onwards, all must take licensing exam. So you need to pass before you get registered. After 10 years, we thought it's about time to look at or pay attention to research. So we launched the TCM research grant. So basically, we want to concentrate and prioritize those applications in the areas of chronic diseases. So basically, we think that TCM has a very important role, even though it's complementary, in management of chronic diseases. So we concentrate on that, and we just launched our 6th grant call earlier, and now we are evaluating all the projects. And which are the projects that will be given priority? For example, you might have published data that show clinical effectiveness or cost effectiveness. especially if you want to integrate them into the current Western medical practices. Or got to do it that improve the health of the population. These are the priorities that we were likely to grant them the research funding. Like improving chronic disease prevention management, like diabetes, hypertension, all this will be given priority, then health benefits and so on. We established an Academy of Chinese Medicine because we thought this entity will help us to train more TCM practitioners to have master or PhD degrees. And we launched the TCM Development Grant. This development grant is actually mainly to support the delivery of TCM services, especially in the areas of infections control, improve patient safety, and we also help them to improve the IT setup in their clinics so they can apply for this grant. Okay, there are more things happening in the last 5 years. We started a compulsory CPE program. In other words, everyone can be registered, but to get a practicing cert, the practicing cert is actually only 2 years. So when you renew your practicing cert, you must get your CPE, 50 points in 2 years. Okay, this started during the COVID, so we had to modify our approach because at that time you can't have face-to-face meetings, so we allow a lot of online education. Still let them meet the criteria. But that is after 7 years of trial. So compulsory from 2000. And we started to extend subsidy and use MediSave. MediSave means that, let's say we earn $100, we put certain sum of money into this account that you can use for your medical expenses. And we selected one condition, neck pain and lower back pain. Okay, why it was chosen, I think at the time it's really based on evidence and also it's a very common condition. So we started this like end of 2000 and we provide subsidy for acupuncture treatment in the public healthcare institution. Okay, so it has been so-called piloted until now. I think things will change. Maybe it will be extended to the community soon. In 2021, because that was during the COVID, we issued advisory on infectious disease control as well as acupuncture and other related treatment so that the incidence of the side effect from acupuncture will be much lower. In order to attract interest in going to TCM, we developed the career and remuneration guidelines to encourage continuous development and improve the professional standard so that there will be more people joining the TCM sector. In 2024, I mentioned earlier, we started our local degree, NTU degree, and we launched the clinical TCM clinical training program. Okay, so this is a competency-based training program, 1 year, just like PGY1 or housemanship program. We rotate the trainees to 4 different big organizations so that they can learn from a very senior or experienced mentor. And we use, this is competency-based, and I think we use what we call, so we look at all these 6 competency, and the way we assess them is we are using the EPA, Entrustable Professional Activities, to assess whether they have reached the certain competency. So this is something when we send candidates or trainees to 2 of the 4 organizations, they themselves adopted this format to train their own trainees. I think EPA was the way to go. And we also, I mentioned about the licensing exam. For many years, our licensing exam are very academic focus or knowledge focus. Now we are revamping it. Things will change. 2 years later, will be competency based. So we change it to what we call Clinical Competency Assessment, CCA. So everyone will take CCA from 2027. Okay, just next 5 minutes, just talk about what we plan to do this and the next few years. We are many years behind many countries in integrating TCM into the Western practice. But we are more serious about it now, and we are okay. So, and it's not going to happen in the whole Singapore, but in public healthcare institution, we'll test it out in the public healthcare because that's where the Western medicine are being practiced. So we're going to select conditions and types of TCM treatment. Certain condition, certain types of TCM treatment in a controlled environment, and we're going to test it out. All this because our Minister of Health is very supportive of it. He talked about this last year. So what we have done is that we are going to have what we call TCM integration sandbox. So this is what we are just starting this to make sure that we know that TCM is an asset. It's an experience based type of treatment. But to unlock this treasure, we had to use a key called evidence-based medicine approach. Okay, basically, but we are not going to ignore the other two EBM. The other one is ethical-based medicine. Ethical-based medicine. So 3 EBM, that's what we are doing now. So that we can, so the patient will benefit and from the best of both worlds. When we talk about evidence, we are actually we're reviewing a lot of evidence published in the last 10 years so that we can decide what condition that we can study and what type of treatment. Is it just acupuncture or herbs or both? And this is what we call the TCM integration sandbox in public healthcare institution. We received about 18 proposals, and we're going to decide which proposal to be supported. Because once we do this, we need to collect data. Because towards the end, we need to know whether they are clinically effective or cost effective. If that, and because of the evidence-based approach, this coming Sunday, in one of the big hospitals, we are organizing a forum on the use of evidence-based TCM in Western medicine practice. So there will be Western and the TCM practitioners in the same hall, using 3 common languages. Number 1, English. Number 2, evidence-based language. We talk about what is RCT, how many numbers needed to treat, and so on. And the third language is we are using Western diagnosis and TCM treatment for a Western diagnosis. That is the common language that both parties will be using. So this is what we will do. And the last part is that we are also, earlier I mentioned that we regulate the TCM practitioners, we regulate the products, but we're not regulating the practices or services. But we are going to do something in between. We're going to accredit senior experienced TCM practitioners and using the Western framework to give accreditation to TCM clinics that fulfill the requirement. So this actually will elevate the status of the TCM practitioners and the clinic, and also increase the population of people's trust in TCM. I think that's my last slide. Yes, thank you for your attention. Oh, sorry.
Thank you, Dr. Lim, for your comprehensive overview of traditional Chinese medicine in Singapore. And our final speaker for today will discuss the role of Vietnam traditional medicine in the prevention and treatment of non-communicable disease. We are pleased to welcome Ms. Tran Thi Phuong Linh, Deputy Director of National Hospital of Traditional Medicine of Vietnam. Ms. Chen Thi Phuong Linh, as Deputy Director of National Hospital of Traditional Medicine, focuses her research on geriatric disease and aging-related health issues. Her specific interests include cognitive decline and dementia, chronic disease management such as hypertension, diabetes, polypharmacy and medication safety, quality of life and mental health in aging population, and preventive healthcare strategy for elderly. Please welcome Ms. Chen Thị Phương Lin.
Today, I am delighted to attend this conference and have the opportunity to share with colleagues from the ASEAN country the topic, the role of traditional medicine in the prevention and management of non-communicable diseases in Vietnam. Because I am a last speaker, so maybe I would like to present the main content of my present. In Vietnam, traditional medicine have a long history. So we have some experience to use traditional medicine in prevention and treatment of disease in general and non-communicable disease in particular. We use the treatment methods such as acupuncture, massage, and acupressure. Herb medicine include the southern and northern herb, qigong, medication, yoga, and breathing exercise. According to the traditional medicine, the treatment method can help reduce the symptoms, enhance immunity, and restore the yin-yang balance, which is essential to the maintaining health. In Vietnam, traditional medicine completes theoretical and practical system for the non-disease management. Traditional medicine shares similar views that Western medicine, the cause of disease and the principle of prevention, the non-communicable disease, such as health maintenance, risk reduction, yearly prevention, avoiding complication and recurrence. These treatment methods are the effective, device, and flexible and easy to use. Example, the integrated with modern therapy approaches, individually treatment regimen, minimal reliance on complex medical infection, herb remedy, access the easy to use, effective across device population, support holistic outcome via integrated care. For practice application, such as neurological and mental health disorder, such example for the paralysis, face paralysis, and posture or insomnia, headache. Yeah. For with the respiratory disease, example for the asthma, COPD, for the musculoskeletal disorder, such as osteoporosis, osteoarthritis, or with the metabolic disorder, example diabetes, hyperlipidemia, yeah, and some cardiovascular disease such as hypertension, hypotension, yeah, and etc. Now, I would like to introduce the use of traditional medicine for the management of non-communicable disease in Vietnam at National Hospital of Traditional Medicine, where I am working. In Vietnam, my hospital is leading national institution, traditional medicine under the Ministry of Health of Vietnam. It is the pioneer the integrating traditional medicine with the Western medicine in the treatment and prevention the disease in general and non-communicable diseases in particular, such as in the department of cardiology, we usually use acupuncture to regulate the blood pressure, massage and acupressure to promote in circulation and improve the blood, and use herb medicine to restore the body function. We can use practice medication and deep breathing exercise to lower blood pressure and heart rate. Besides, we can use therapeutic meal combining nutrition and medication benefits to support the treatment recovery. In the department of geriatrics, with the metabolic disorder such as diabetes and dyslipidemia, we use the combination of acupuncture and therapeutic massage to stimulate the pancreatic function, improve blood circulation in the limbs, and reduce numbness. We have still used herb medicine is used to help stabilize blood sugar level and minimize the diabetes complication. Besides, the patient can use the practice traditional exercise such as life nutrient exercise and qigong to enhance blood glucose control. We have still used the treatment by the medicinal mirror to just therapeutic can help the patient regulate blood sugar and correct lipid imbalance. In the department of oncology, we usually combining traditional medicine and chemoradiation therapy to increase the anti-cancer effect, reduce the side effect and complications of chemoradiation therapy. And the traditional medicine, the methods can increasing the resistance, improving the quality and health of a patient. Is the department of dermatology or the department of musculoskeletal. Yeah, some disease in this department is the osteoarthritis, osteoporosis, the degeneration of the bicervical spine, back pain, sciatica, and etc. Maybe depending the symptom of the patient, and the doctor can select the suitable method. Can use the traditional medicine or to combine the traditional medicine with Western medicine for treatment patient. Besides the success recognized by the patient and society, have some challenges when use traditional medicine in management in treatment and prevention non-communicable in Vietnam. That is that challenges is as conceptual challenges, social challenges, human resource challenges, and especially the challenge in drug quality and traditional medicine development. That these challenges are significant impact to the develop the traditional medicine in Vietnam. To overcome this difficult, so some solution that is the strengthening the communication, awareness and education, research and development, such as encourage scientific study to validate traditional medicine effective, support clinical trial and pharmacological research on herb medicine, faster evidence-based integration with modern treatment, use database and documents of traditional medicine knowledge, training and education, organization and the collaboration such as the Shenzhen institution framework for traditional medicine at national and local level, encourage collaboration between traditional medicine and conventional medicine, support good policy and global action plans on traditional medicine integration, faster public-private partnership for traditional development. And conclusion. In Vietnam, traditional medicine plays a vital and distinctive role in the management of non-communicable diseases through its holistic approach, use local herbs and non-drug therapies. Integrating traditional medicine into the national health system offers a sustainable solution for long-term health care in Vietnam. This is the end of my presentation. Thank you for the attention. Thank you.
Thank you, Dr. Chen Thi Phuong Ling, for your presentation. And ladies and gentlemen, we have reached the end of our session. So to bring our conference to close, I would like to invite Dr. Anjali Juthaputhi, the advisor to the Department of Thai Traditional and Alternative Medicine in International Corporation, and also she was the former Director of Technical and Planning Division. Dr. Anjali, please.
Good evening. Now we come to the end of today's program. And as we conclude the ASEAN Conference on Traditional and Complementary Medicine, I extend our sincere appreciation to all speakers and participants. Your valuable insights and contributions under the theme Traditional and Complementary Medicine for Chronic Non-Communicable Diseases have underscored the vital role of traditional and complementary medicine in addressing today's health challenges. We thank our excellent speakers from the World Health Organization, China, India, and ASEAN for sharing their experiences and expertise, which have given us up-to-date knowledge of global strategy and national policies in TCIM and current status of traditional medicine in ASEAN, and also research strategy and research trends of traditional medicine in non-communicable disease in ASEAN that will help shape our future collaboration. Let us keep this energy going, and I think we have to thank the PITAC of the Philippines that will carry on our traditional medicine collaborative torch forward in next month meeting. The partnership and knowledge share here will help shape stronger policies and more integrated healthcare across ASEAN. Thank you once again for your contributions to this conference. We look forward to continue collaboration and progress in advancing traditional, complementary, and integrative medicine in the region. Thank you very much.
All right, everyone, that brings us to the end of our ASEAN conference. We hope you found today's session insightful and valuable. Before you head out, we greatly appreciate it if you could take a few moments to fill out our evaluation form. Your feedback is incredibly important to us and help us improve the future events. And to access the form and receive your e-certificate, simply scan the QR code that's displayed on the screen. Again, that's for both the evaluation form and your e-certificate. We really value your input. Thank you all for active participation today, and we look forward to seeing you again soon. And for the participant of ASEAN, all speaker and Timor-Leste, we invite you to have the welcome dinner together. I would like to make that we will meet at the lobby of Novotel at 5:30. We will leave the hotel at 5:30, so maybe you come a bit early before time. Also, for Myanmar delegates, please wait at the lobby of Novotel. We will leave the hotel together to the restaurant venue. Thank you. Below stairs.